Muthu Vaduganathan and Mike Gibson, coming to you from clinicaltrialresults.org, and we're talking about the MRA axis in the treatment of heart failure. Tell us about the state of the art.
Absolutely. Thank you, Mike, first of all, for having me. And it's such an exciting time for heart failure, chronic kidney disease, and other chronic disease states. We've long recognized that the MRA pathway, the mineralocorticoid receptor, has been really the center of some of the pathology of disease progression, especially in the heart and kidneys. And traditionally, we have inhibited this axis with steroidal MRAs, such as spironolactone and eplerenone. And we've known this now for over 3 decades, that inhibition or antagonism of MRAs and the nuclear transcription of proteins and downstream production of proteins that influence pathways like fibrosis, inflammation, hypertrophy is important in heart failure and chronic kidney disease, not only incidence, but also the development and progression of the disease. And now we are actually newly targeting this axis with a number of new therapies and new pathways. And the reason is that the MRAs, the traditional MRAs, like spironolactone and eplerenone, have been challenged by some safety issues, particularly hyperkalemia and worsening kidney function, and that has limited their broad use, especially in high-risk populations that may benefit from these therapies. And so in certain regions, like in the United States, we've seen suboptimal uptake of these therapies in high-risk populations. And so there's been great interest in developing new therapies with potentially better either safety, efficacy, or pharmacological profiles that may offer a solution for that unmet clinical need.
And can you talk a little bit about some of those newer solutions and where we're heading?
Absolutely. So the first classes that were developed were the non-steroidal MRAs. And so these were structurally and chemically different from the steroidal MRAs. They don't have that four-ring steroidal backbone. They may have more balanced tissue distribution in the heart and kidneys. And in small phase 2 trials and head-to-head comparisons, they actually, because of potentially less kidney-specific effects, they had lower risks of hyperkalemia. The first of which has been studied at a large scale was the Fine Arts heart failure trial with the non-steroidal MRA finerenone, and that was shown to be beneficial in reducing cardiovascular risk in heart failure with preserved ejection fraction and is under regulatory consideration. There are a number of other non-steroidal MRAs in various stages of development and testing. Additionally, there are unique MRAs that, for instance, MR modulators that may have differential effects at differing levels of the aldosterone, the actual agonist. And an MR modulator called balcinrenone is being studied in a late phase clinical trial called Balance DHF, and this is in patients with worsening heart failure. Now, very excitingly, because we've really narrowly focused on the MR receptor, the nuclear receptor, but we know that aldosterone itself circulates and is produced and may act actually on distinct aldosterone-specific receptors, even outside of the nucleus. And so perhaps inhibiting the very synthesis of aldosterone upstream might be additionally incrementally beneficial. And so beyond the safety side, maybe there's additional efficacy with the aldosterone synthase inhibitors. And so these are now being studied not only in chronic kidney disease, but also in heart failure with reduced and preserved ejection fraction. So far we've talked about established disease, people with established chronic kidney disease, established heart failure. Now we're actually moving upstream and trying to understand, can we actually prevent the onset of illness? And these aldosterone synthase inhibitors are now being studied in the prevention of heart failure in at-risk populations, for instance, with type 2 diabetes, hypertension, and atherosclerotic cardiovascular disease. The first of which trial that's been announced is the PREVENT-HF trial. This is a large-scale heart failure prevention trial and probably one of the first modern heart failure prevention trials that has been designed. And so very exciting time, not only because of a number of therapies inhibiting the same pathway and axis, but also covering the spectrum of disease of both prevention and treatment of heart failure.
Well, I learned about spironolactone when I was in medical school. It's just so funny that what's old is now new, this axis. There's so many new shots on goal. Pretty exciting. Luther, thanks for joining us today.
Thanks so much, as always, Mike.